Good morning and welcome to Senator Myron Dorn, legislative candidate from District 30. Thank you, Senator, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers, Joyce Beck and Mike Barwig. Danny DeLong is also one of our lead advocacy volunteers, but Senator Dorn, he's also one of your constituents, so I wanted to point that out to you today. Emily Wick is also joining us today to assist with some of the technical details for the program. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So Senator Dorn, we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50+ voter and their families in your district and across Nebraska. As background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So Senator Dorn, if you don't mind taking the first or kicking us off and starting the discussion, talking a little bit about your background, about yourself, your campaign, in maybe 5 minutes or less. And once we've completed that, we'll move into the questions. So if you don't mind, Senator Dorn, I'm going to pass it back to you.
You bet. Thank you. I've been a lifelong Gage County resident, except for a couple of years when my wife, she works at Bryan Hospital in Lincoln doing heart ultrasounds. We had to live close to the hospital before the so-called cell phone revolution we have now. And she had to take calls, so we had to be so close. And now after about 3 years of that, we were able to move back down to the farm, and we've lived on in the Adams First vicinity all my life. Served on co-op boards in the area for about 20 years. And then I was successful to serve on the Gage County board. I served on there for 8 years, 4 of those as chairman. And many of that time while I was on there, or much of that time, we had the Beatrice 6 issue, and that became a part of what I have worked on some bills in the legislature and stuff. After 8 years of that, I had people approach me and ask me if I would run for the legislature. Senator Roy Baker was our current District 30 senator at that time, decided not to run for his second 4-year term. And then I ran and was fortunate enough to get elected, been in the legislature now almost 4 full years. Yes, I am running one of 2 senators, though, myself and Senator Brandt, that are running unopposed this year. So, it's thank the patrons that have shown faith in me, and it feels good that I guess they have and think I do a good job up there. So we do try to do that. It's interesting. The one thing I've learned in the last 6 months or a year or whatever is how the redistricting has changed, especially in Lincoln. And I'll have people come up to me and go, "Hey, you were my senator, but now you're not," or "Yes, now you're my senator." And that changed some in the Lincoln area and stuff. So it's interesting to visit with all those people and constituents, and look forward to the next 4 years.
Perfect. Thanks, Senator Dorn, for sharing that. And again, I just want to extend our appreciation for being an aging advocate and all of the things that you have supported in the legislature in your past. And we do look forward again working with you as you move into your last stint in the legislature. Ahead of this, we did provide you with a set of 3 issues containing 4 questions that were pertained to the 50+ in Nebraska. Again, because of our time constraints, we're looking at about 5 minutes for each question. And I think these will all be easy questions for you because it's a lot of the work that you have done. But our first question is on health, caregiving, and home and community-based services. And Mike Barwick's going to take that. So go ahead, Mike.
Good morning, Senator. Glad you can join us. So home and community-based services, also known as HCBS, provides an array of services designed to assist individuals with activities of daily living that promotes independence to support them to age in place or delay institutional care. A family caregiver is any family member, friend, or acquaintance who cares for another person that is unable to live independently, often without pay. Telehealth services can be significant for older adults in rural areas or underserved communities, while also providing support to family caregivers by reducing travel, wait times, and costs associated with in-person care. The first part of the question is, What will you do to support the 240,000 unpaid family caregivers in Nebraska through policies such as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket costs? And the second part of the question is, what will you do to protect and or expand the Home and Community-Based Services, HCBS, program, particularly recruitment and retention of a sufficient workforce and adequate funding of the services that Nebraskans and their families rely on?
Well, thank you for that question. You mentioned a couple things in there that I think the last several years with our COVID issue has really brought some of those things to more of the forefront. You talked about right at the end there, workforce and what will we do for workforce. We're facing as everyone knows, a shortage across the state, particularly in nursing homes and healthcare and home care type settings. It's the same thing everybody else is facing. We are advocating, I said on the Appropriations Committee, we are trying to or have been working at funding some areas to help with the homes. If you don't have houses for workforce, you won't have people go there. I think this last year with AARPA, between AARPA and the regular general fund, I read somewhere that we included over $100 million for workforce housing. Those are small things, but all those small things can help the colleges, the university, so that we keep our young people here as they look to further their education, and hopefully they will stay here and join the workforce and be part of Nebraska. We hear about that we lose some of those people, the brain drain or whatever, trying to implement policies so that we keep those people here. It may not seem like that matters at all to, I call it the retirement community, but those people here, we need those people here to have the good job, the good workforce, and help. I call it free up some people so that they can work in some of these other professions. In Appropriations Committee, we've really looked at the last few years, I call it the nursing home situation, what's going on there. We did bump up a little bit in the rate of Medicare that we were able to implement in that. We also did the providers. We increased some in the general fund and some in with AARPA funds, which was more of a one-time thing for the next couple of years, some salaries that they haven't been receiving the prior years at all, some salary increases. So that's been very, very important. I can't remember who it was. And as you were talking there, I remember somebody brought a bill, and I think it was, he's out of there now, the senator from Omaha brought a bill so that people that stayed home and cared for elderly people could have a relief from a job and also maybe some funding for that. I see that coming back in the next few years. I don't believe that bill passed there a couple of years ago, but that is an issue that definitely will be brought to the forefront. I applaud you and all of your people that keep bringing us those bills and keep bringing us some things that can definitely help. I call it the retirement community. That population right now, it is not decreasing in size. It's probably increasing. And then I talked a little bit about COVID. COVID brought to the forefront so many issues. One of the things you talked about was telehealth. Telehealth has been almost a lifesaver at times during COVID for not only elderly people, but the general population as we worked with the medical field because of the issue of not going out and not being able to get there. I continue to work and continue to support those types of issues.
Thank you, Senator Dorn. Our second question, and we've kind of dabbled a little bit in this already, but we'll continue the discussion. We kind of switch over specifically into nursing facility care and quality of care. And Joyce is going to take that question. So go ahead, Joyce.
Thank you, Senator Dorn, for your time today. Over 20,000 Nebraskans require care in nursing facilities or in assisted living communities. Facilities have closed their doors, citing reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs, and RNs by 2028 to meet Nebraska's care needs. Everyone, regardless of where they reside, deserve to be treated with dignity and respect and have access to quality medical care. Better staff to resident ratios improve the overall quality of care and the well-being of the residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across long-term care services and support industry. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. So, Senator Dorn, here's my question for you. What will you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
Well, thank you for that question. As you're reading the question and several of the comments you've made there, as you said on appropriations, we have many of those discussions throughout the year. The Nursing Home Association, the people, the nurses and all of these, they do definitely bring issues or funding requests in front of us. So we've had some good discussion on it. Senator Stinner, who was our leader in appropriations, who won't be there next year, was a very, very strong advocate, as many of the rest of us are, for nursing homes. I believe 2 years ago, I think there was around 15 of them closed. I don't remember what the number is this year, but we've had some very, very unfortunate. All of those things you mentioned, the staffing issues, the nurses, the rate that they get reimbursed. It's amazing how a little bit of help from Nebraska in that reimbursement rate has helped some of those nursing homes, because we've seen the data that if you're going to be 90% Medicare reimbursed or whatever, you're not going to make it as a nursing home. You have to have a different mix and stuff and all of that. I've continued to be a champion in Appropriations Committee and on the floor for additional funding. I did have a bill last year. It was brought about by the hospitals and their nursing home, their nurses association. I brought a bill of $5 million in AARP funds for scholarships going forward for the next 2 to 3 years for nurses going to schools. So I don't remember the number of that bill, but I think that should help. Yes, we're definitely facing a shortage of nurses. COVID, I know we were facing a shortage before, but COVID brought about other issues that just expounded on that and made it almost at times a crisis situation. My wife's in the medical field, my daughter's in the medical field, and I hear a lot of times about the challenges and the working hours and all those things. And we need to do everything we can financially and otherwise to support them.
Well, thank you for your answer. I appreciate it.
Thank you, Senator Dorn. And again, thank you for all that you have done, especially through appropriations and representation for facilities and so forth. And again, at the end of the day, we're coming from the consumer perspective. So the resident in the nursing home, they will get better care by having those higher numbers of staffing, the higher reimbursement and so forth. It's the trickle effect. And so we do, they all kind of fit together. So again, we appreciate your leadership on that. And certainly as we move forward, we'll be looking to you for some more leadership.
I'll make a quick comment too. I am one of the fortunate ones that we have. I live a mile from Adams, lived in the Adams vicinity all my life, and we have an excellent nursing home here called the Gold Rush Retirement Center. The administrator right now, Jeff Fritzen, there. I don't know how many times a year we visit, but I get to. I consider myself fortunate in the fact that I am more up to date on a lot of the issues that really are at the top of their list and what they're struggling with the staffing, the COVID. Pay increases. And I just had a friend here a week ago that wanted to have somebody come into here as a resident, and because of staffing issues, they didn't have a room available at that time. And this isn't the only nursing home facing that situation. There are many of those. So then they, you look at, well, where are we going to go, or where are we going to do, or they waited about 4 days and then a room opened up. So they were very fortunate. But those are the challenges we're facing. If you're out in Western Nebraska, the next nursing home might be 60 miles away. And man, when you, there's a lot of issues then that go on there when you have that far of a distance. So thank you. Yep.
Absolutely. And one final comment too, you're right, that those distances create barriers, especially for a resident who maybe was taken care of by a spouse at home who now can no longer see them, or vice versa, the spouse can't travel that far. So yeah, I agree. There's a lot of mental health, behavioral health. There's lots of issues that come to light here. So again, not to belabor the point, but we do appreciate all your leadership and certainly look to that as we move into the future. So thank you, Senator. Our third and final question for discussion today is on helping people stay in their home, and it centers around livable communities. And Danny DeLong, again, a constituent of yours, is going to take that one.
Morning, Senator Dorn. Good to see you again.
Yes.
We're going to talk a little bit about the concept of livable communities. AARP routinely has polled over the last few years people that are 50 years and older and asked them what their priority is. And 75% of them say, I want to age in place. I want to live as long as I can in my home, and I want to live as long as I can in my community. And that's what we're going to be doing here just in the next few moments, is kind of defining what we think a livable community should offer. And the first feature is a safe and secure community. So communities, no matter what their size, need to have adequate safety and security infrastructure for the protection of the people who live there. A second feature that's important to us is that affordable housing should be available to, as you've said and eloquently, the new younger people coming in, but also older people who will need to sell a larger home that they don't need anymore, but then they'll need to move to a smaller home. So affordable housing options are really important in livable communities. We also think that transportation should be made available and in all communities. That's a tough go, I know, in rural areas. People have difficulty finding transportation because they need to go out of town because there's no longer a doctor in their community, or no longer a pharmacy in their community, or maybe no longer a grocery store in their community. So transportation options of all kinds that are affordable are important. The fourth feature is probably kind of a dual feature. It is livable communities provide supportive services for people of all ages, allowing people to remain in their communities as they age. Two of those services are access to health care. So we need a robust care profile in that community, or access to it through transportation, or through the next part of a supportive community features, high-speed internet. And so we need to have high-speed internet that allows people lots of options in terms of how they interact with the world outside their community, as well as how they interact with the world inside their community. The high-speed internet option is important. I know you've worked on it. I sat through your presentation on precision ag, high-speed internet for precision agriculture, to the Transportation and Telecommunications Committee last session. And we think high-speed internet should be affordable, reliable, and accessible for all Nebraskans. As a part of high-speed internet accessibility, We think that people need to have access to training in digital skills, and what we would call digital skills literacy. So knowing what kinds of devices are going to work, and also knowing how to work them so that they can bank, shop, line up transportation, have Facebook sessions with families, with their family members who may live in other communities. That's an important feature, is high-speed internet. So my question then is, what will you do to ensure all Nebraskans, mainly those 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate healthcare, and affordable, reliable, and accessible high-speed internet, including digital skills development?
Thank you for that question. As you were talking there, visiting about the many different things, a lot of things kind of enter your mind, and you want to go, hey, here, I'm going to talk about that. You know, in Nebraska, we face that challenge. We have a great state because we are so diverse with agriculture and many rural areas, but with that brings particular challenges about high-speed internet. Knew there was challenges with that before I came to the legislature. The 4 years I've been in the legislature, it's been a priority of many of the senators to improve that. COVID came in and made some more challenges. That takes funding. We, as a state, has committed quite a bit of funding in the next few years. I believe the governor had something about between the state and federal and AARP where there's going to be over 100 million available the next 2 to 4 years for this. I do know there are many different programs in place to help with that, but it takes a little bit of time and to get those all out. And it will also take more funding and more, I call it's more at the forefront though. So we're more aware of it and we're more making that a priority or whatever. That is so critical. Many of the rural areas that have a decrease in population, they can trace that back to, or one of the main issues is the high-speed internet. During COVID, you heard about some communities out west that the kids, mom and dad had to bring them into the town from 7 o'clock at night till 10 o'clock at night because the library or the school then had the high-speed internet that they could get. So there's many things like that, but that'll get better. When you talked about training for the elderly or the people, we don't grow up with it, or we haven't grown up with it. It's amazing how often we'll ask our 10-year-old granddaughter, hey, how do we do this? And we shouldn't have to, but yet it is. It's a great resource. And we're so thankful. I think of my parents or my wife's parents, and my wife's parents never had a computer. They just, they were at that age where it just wasn't something that they were going to do. And yet here we are in today's world where our phone is basically our computer in a way. So we're going to continue to support all those things. We're going to continue to support the housing. I think the workforce housing, the rural housing, to make that more accessible to people. You talked about it, or one of the others talked about affordable to housing. How many people would like to stay in their home or in their community and to have that affordable housing? One of the things Goldcrest has done up here and has really been successful, and they have a waiting list and building more all the time, is they call them duplexes, or 1 or 2 bedroom apartments that are really, nice. They're flat. They're on one floor, so you don't have any steps. And there is a thing there that if you need help, you can buzz and somebody from the nursing home will come over, or if you need food for a week, they'll make that. So there's many of those types of programs, but you kind of have to be fortunate in a way to be in those areas. Like I said, here in Goldcrest, there's a waiting list. You need to tell them a couple of years ahead of time if you'd like to think about moving in there and stuff. So, but it's a beautiful place, and those will develop more. One of the things through all of this, 2 things. Yesterday, I was at a child care, and the Buffett organization helped put that on out at Kearney. They had 400, 500 registered people. their main speaker was from Chicago. And one of the things I remembered about her talk was she said, becoming involved in, that's why I thought the timing was great here with AARP, becoming involved. And she says, you think that doesn't matter? It was in 2017, it was nationally. And she showed a picture of some of the successes and some of the things that ARPA has worked with and some of the accomplishments that they had that 30 years ago was on nobody's horizon or whatever. So becoming involved, like your group, like other groups, being out there. One thing I've learned with the legislature, if you're not at the table, you will get left behind because generally you don't get brought in later and all these things. So it's very, very critically and important for that. So I thank you. I applaud you for doing that, for having these types of things and for working with everybody. I was going to say something else and now I got off track. So, but no, it is tremendous to have you. There are so many things that become involved in all of this. I know you guys look at it, other people do. A year ago, I had one of the lobbyists lunch with him. That was after we had the 10 days of bills. And there was about 600 bills, 600 bills introduced. And he was spending times reading those and for his different clients. And I said, why are you doing all of that? And he says, we will have, our clients will have about 300 of those 600 bills that will affect them in one way or another that we will put out here. You need to make sure you look at this, or we will directly look at it. So it does affect a lot of people. There's a lot of different variations can go on, a lot of different bills. And there are so many things that in the end, we will work through the process. They will have, some of them will have hearings on the floor. We'll narrow those bills down. Some will get amended in, but I'm thankful we have the process we do where people can have their voice heard and that you do feel like you get that opportunity to have your someone listen to you.
Thank you, Senator Dorn. I'll see you at the unicameral, if not before.
If not before, yes.
Yeah, thank you.
Perfect. Thank you, Senator Dorn. And we are coming to the end of our 30 minutes in our meeting. So I do want to offer back to you the final minutes for any closing thoughts or comments you might have for our members and of course the constituents of your district. So if you have anything in closing you want to make, now would be the time to do so.
No, I thank you for taking the time to do this. I enjoy always visiting and look forward to working in the next 4 years and helping make Nebraska a better state. The one thing I'll talk about is, with a couple senators that will be their first time because of one a death and the other one an election, we will have at least 16 new senators, somebody said this year. So that's a third of the senators. We will have a new governor. So some of these things might not, will take a little time to, I call it, work through the process. With Governor Ricketts, a lot of people, his philosophies, you pretty much knew what they were, and he was going to generally stick to those or whatever, but he also was able to work with different groups. We'll see the new governor, how they handle these things, but looking forward to it. It'll be an exciting time again. It always is.
Perfect. Thank you again, Senator Dorn, for taking the time to visit with us. Again, I want to just acknowledge and thank you for your leadership in the legislature, also your leadership on aging issues. We do appreciate you, and we do look forward to working with you again for the next 4 years. We wish you the best, and thank you for meeting with AARP today. Take care.
Bye.
Thank you, Senator Dorn.
Thank you.
Thank you.